and it sells itself. When you get somebody better in one visit, they're like, how do I do more of this, doc? You finally found the thing that's going to do it. And I think one of the biggest pieces of feedback we get is like, why aren't we teaching this?
Yeah.
Right. And thankfully the answer is we are now.
All right.
Right. We're 40 years behind, the European system, but we're finally learning about it in school because it deserves its day in the market. It deserves to be a part of an option for our patients that's non-invasive.
Yeah. And if I'm not mistaken, Shockwave Centers of America, 2 different units.
Yeah.
Just what's the difference between the 2?
Nice thing is very little.
Mm-hmm.
We built our flagship, which is our clinical model, which we call the Mark III. I'm a super Marvel nerd, and so I named them after Iron Man suits. But the Mark III is that first perfect unit, the one that actually works well for him, and he crushes it in one of the movies. And then we have our portable model, which is the Mark V, which he carries around the suitcase in the second movie. Okay. But we created the second unit, that portable unit, for the clinician on the go. So PTs and chiros who will go to events and they need to actually have it with them. Mm-hmm. When you go smaller form factor, you give up some niceties when it comes to the longevity of the device.
Yep.
So if you're a higher volume doc or the machine stays in the office, 100% of the time, the clinical one is going to be the better choice for longevity, easier to swap parts out in the future, because it's one of those things, like pretty much every other technology, is that things will wear out over time.
Yep.
And how easy is it to change out and how often do you need to do it will make or break the decision-making process, right? A lot of our providers will go with clinical and then they'll end up with a portable one as their second unit.
Yeah.
Right. And for me, I use the clinical one in its own room with my consult stuff. And then the portable one comes out with me if I need to wheel it up to my semi-open adjusting area. I can do a quick trigger point therapy, or I can do a quick elbow. That doesn't disrupt the flow of everything. But if I'm doing like a hip and a low back and stuff like that, I may take them to that separate room back there. So some of it's going to depend on the practice. We have independent contractors and mobile chiros to have the portable one. Of course, that makes total sense. Clinical value-wise, they're going to be the same. The how they produce the Shockwave is going to be the same. They use the same handles. It's all about how often am I going to use it and where is it going to be actually utilized the most.
Yep. What haven't I asked that you think is really important for docs to know?
Well, what can we do with Shockwave? What are the parameters and where we would use it? Where wouldn't we use it? So there's 3 major items that we can target with the device. One, at the most shallow, which is going to be your trigger point and just your pain relieving aspect of Shockwave. So when I look at the device, I'm going with a faster and a more gentle shockwave because I don't need it to penetrate very deep.
Yep.
Right. Our devices penetrate up to 8 centimeters deep. Some other devices on the market go up to 12. Some of them stop at 4. But depth of penetration is important for safety, for what kind of patients can I see, which ones can I not see with it. Right. And so for us, if I'm doing like I said, a gentle one that's surface level, awesome. That's easy. Takes 2 or 3 minutes. Then you get into a little bit deeper and a little less fast, and it's going to be that stimulation of healing. And so that's the regenerative aspect of Shockwave, right? And so that's where we're targeting tissue that can replicate itself to repair and make sure that we're getting full healing in an area that may not have healed properly the first time, or something that just needs a little boost in the right direction.
Thanks so much for checking out that interview. If you liked it, we have plenty more available. You can check out the next interview right here.